So today we're reporting 94 new cases in the community. 87 of these are in Auckland and 7 are in the Waikato. The new cases take our total in this outbreak to 2,099, and of those 1,384 have recovered now. Of today's cases, 53 are yet to be linked to a current case, but interviews are underway. What I would say is that all 7 of the cases in the Waikato have already been linked to existing cases. Of yesterday's 60 cases, 19 of those remain unlinked at present, with investigations ongoing. Today there are 38 people in hospital with COVID-19, and all of those are in the Auckland region. 5 are in either ICU or a high dependency unit. As I said, the 7 cases in the Waikato today have all been linked, and so now only 2 cases from the total number in the Waikato are as yet unlinked from last week, and 2 cases reported on Sunday. Investigations continue on. There is region-wide testing continuing across Waikato, and that is very important while it remains in Alert Level 3 to help inform our advice and the decisions later in the week about the ongoing status of the Waikato. Testing is available across Waikato. Please do look on the HealthPoint website or the Waikato DHB website. And for anyone in Waikato, and indeed anywhere across the Motu, if you have not been vaccinated yet, today is the day to do it. Please check on Book My Vaccine as to where you can get yours done. So on to vaccination, the COVID-19 Technical Advisory Group has recommended that individuals aged 12 and older with severe immunocompromise receive a 3rd primary dose of the Pfizer COVID-19 vaccine. It's important to note this 3rd primary dose is different to a booster dose in the general population. Severely immunocompromised people are at high risk of severe outcomes for COVID-19, and because of their immunocompromise may not produce a sufficiently strong immune response to just 2 doses of the vaccine. So a 3rd primary dose can be of benefit in this group, and that includes those who are taking immunosuppressive therapies, for example, if they've had a transplant, before or after their 1st or 2nd dose of the vaccine, as well as some individuals with chronic diseases. The Technical Advisory Group will continue to review the emerging evidence for a booster dose, and once we have received an application from Pfizer and advice from the Technical Advisory Group, as well as a decision by Cabinet, we will be providing further advice around the progress with booster doses, and we will have an update next week on where the current status is around wider booster doses. And finally, yesterday I was asked about the number of people who are pregnant who have been hospitalised during the current outbreak. Based on the latest data we have, there have been 5 cases recorded where those people have been pregnant and they have been hospitalised as part of this outbreak. You may recall last month, in mid-September, while noting the good work done by midwives in Auckland during Alert Level 4, we noted that we had seen unvaccinated pregnant people arriving in hospital and quite unwell because of the virus. So I would like to reiterate that there is now very clear evidence from experience globally, indeed our experience here, that vaccination is not just safe but is highly protective for pregnant people, and there are no additional safety concerns in pregnancy.
I know the highs and lows of cases, it's incredibly hard on people, particularly those in Tamaki Makaurau. I just wanted to reinforce again that we're not powerless. We do have the ability to help keep cases as low as we can. Now, we spent a bit of time talking about that yesterday, but just a reminder again, the cases that we're seeing in Auckland right now are not confined to one part of Auckland. They are across 124 suburbs. I say that only to remind everyone that the rules matter for everyone, and our ask of testing if you are symptomatic applies to everyone. In fact, this morning in our briefing, a particular focus from our public health team on the fact that they have a positivity rate, so the amount of testing relative to the number of positives coming back that is of concern to them on the North Shore. So if you are on the North Shore experiencing any symptoms, even if you have been vaccinated, please do go and get a test. And to everyone, please remember, this outbreak is not in one part of Auckland. I think the second interesting observation is that the highest number of cases today are across the 3 age ranges that are least vaccinated, and that's the 39 years and under, keeping in mind, of course, for the 12 years and under, they're unable to be. We need everyone who can be to be vaccinated. If you are young, you are sadly not invincible. 12 of our current hospitalisations are under 39 years of age. We all have a part to play. So there are 2 things I ask of all Aucklanders again. One, please do get vaccinated. There are 158,522 eligible Aucklanders who have not had a first dose of the vaccine. It is within this group that virus has the potential to spread and who we really need to ensure are vaccinated so that we can ease restrictions with low case numbers. Today I'm also urging all those eligible to get their second dose to bring that forward and get it as soon as possible. If you had your first dose more than 3 weeks ago, you can now get your second. The quicker we can get people fully vaccinated, the greater the community protection we have against the virus. So if you're watching this at home now, make a plan to get vaccinated this afternoon. There are plenty of walk-up and drive-through options across Auckland. Go to covid19.govt.nz. Finally, I will again just reiterate that call for everyone, please, to still stick with those rules. At the beginning of this outbreak, we used to use the phrase, stay home, save lives, to describe what was needed. And that still remains the case. I know it's hard, but we are so close. And we know that vaccinations are already making a significant difference to the outbreak in Auckland, but so too are people following the rules. Yesterday, Cabinet decided not to move Auckland back into level 4 as a circuit breaker. And that's because we have the ability with the restrictions we have now to keep making a difference. And again, we have unfortunately continued to see cases reported today that have come from non-compliance of level 3. Staying home, limiting contact, only catching up with people outside in groups of 10, and getting vaccinated are all actions we can take to stop the virus from spreading.
First, can I thank all Maori providers, iwi hapu practitioners, vaccinators and staff in our DHBs that have worked tirelessly over the past 18 months on the COVID response, and now as part of the efforts to vaccinate our whānau. Your efforts are indeed seen. In the 2 weeks prior to Super Saturday, I've travelled to a number of DHBs to better understand the challenges and successes in the vaccine rollout to Māori. I saw some great work, but identified a number of challenges. We know too that primary care is critical for our whānau. To our GPs, pharmacists, practice nurses and practice support staff that are already on board, thank you so much for your help. For those that aren't on board, can I ask for your help too? Our whānau need you, and for many of them, you are the trusted person that will be key to them making an informed decision about the vaccination. Significant funding has already been provided to Hauora Māori to support and build capability for the vaccine program. Our communities are going the extra mile to support one another to get vaccinated, and I know on Labour Day in Counties Manukau, Heroes in the Street campaign is happening. Our Māori GPs, nurses and community leaders are going street to street on buses to engage and kōrero with whānau to encourage vaccinations. If you need support to make your decision, get your information from official sources, or you can speak to one of our kaumātua and kuia who are currently leading vaccination rates amongst Māori communities. As a government, we will be making further announcements to support the Māori vaccination effort later this week. We've seen the threat to this current that this current COVID-19 outbreak is to the well-being of Māori communities, with a total of 560 Māori cases recorded. In the last 2 weeks, Māori have made up 45.7% of total cases versus 28% throughout the entire outbreak. Although sobering, these numbers reinforce why vaccinating our communities is so important. Nō reira ki te iwi Māori, kei runga te mate uruta I te mahau o tō whare. Kaua e tukuna kia uru mai. Ko te ārai motu hake, ko te kano ārai mate. So I say to the Māori people, COVID-19 is on the doorstep of your houses. Do not let it enter, and the best course of protection still remains for us to vaccinate our people.